Some very tragic news earlier this month. A 2-month-old baby tragically died at Starship Hospital on July the 19th. A Manawatu pharmacy allegedly dispensed an adult dosage of phosphate, resulting in lethal toxicity. Her grieving parents are now calling for compulsory second-person checks on medications before they're dispensed to prevent such devastating errors. Health regulators, from MedSafe to the Pharmacy Council, are urgently investigating the incident, while University of Otago's Dr. Jason Wister, who is a neonatal ICU clinical director, supports the proposed law change. He noted that two-person checks are already standard practice at NICUs and calls the law tweak a safe, low-risk, high-reward policy that wouldn't take much time to implement. Pharmacists, including Lanny Wong from Mangawhai Pharmacy and National Exec of the Pharmaceutical Society, backs the idea too, but stresses the need for more staffing and better support across the profession. And she joins me now. Lanny, good morning.
Good morning, Leah.
I appreciate your time. I see that you are working, of course, in your pharmacy, and especially in light of such a tragic case with the death of a baby. Has what happened possibly highlighted something that pharmacists may have been worried about for a while?
Yeah, I think what you mentioned before, having two people checking your prescription, is certainly is desirable, but the reality is that we haven't got the workforce to support that. I think, and I've mentioned this before, is that the pharmacy workforce is in crisis. Among the OECD country, we are one of the lowest. 7.95 practicing pharmacists per 10,000 population in Aotearoa. And that's compared to 9.3 in Australia, 9.1 in the UK, 9.6 in the US, 10.4 in Canada, and 11.4 in Ireland. So we are a very stretched workforce. So to achieve that, there needs to be, a lot of changes to the system, if that makes sense. Yeah.
Yeah, no, I see that, because I think about the pharmacies that I go to, and some have two people, some have one, they run it just themselves. So can you explain how it currently works? I'm sure most of us kind of know, because we can see you, but I hand in my prescription, you process it, and then you give it back to me. Now, ideally, would there be a second person normally having a look? Or even if there is a second person, would they check your work, Lanny?
Yeah. So every pharmacy is a little bit different, but what I can talk to is probably my pharmacy. So right now we've got about sort of 6 people in the dispensary, and 3 of them will probably be working on the main prescription, if that makes sense, and the rest are doing other work that needs to keep the dispensary ticking along. So usually the prescription go through, at my pharmacy, the prescription do go through 3 sets of eyes. Usually one person will be entering the data, collecting the medicine, and the final person, usually the pharmacist, will be doing the checking. So if there was a complexity or some sort of error, sometimes that do get picked up, and sometimes if a prescription is quite complex, then we do get someone to double check the final check, if that makes sense. So that is usually the gold standard, double checking, and that can mean checking your own work twice or getting someone else to check it. So it's very and that's up to the workplace to determine how they do things. But but generally it is I guess the minimum acceptable is that the final check needs to be done by a pharmacist. That is the absolute requirement. And the final clinical check is always done by a pharmacist. But for complex stuff, for practice or safety purpose, we do workplaces do ask for 2 checks, but that is at discretion.
So that's interesting. So that is at discretion, and that is how you run yours, and how I'm sure a lot of them do. But you've also mentioned that your industry like the medical industry as a whole, is struggling with staff and people coming on board and new pharmacists joining. So I went onto one recently, and there was just one pharmacist at the back of the shop, and from what I could see, there was only him. Now there could have been another one that was on a break. So in that case, that one pharmacist, how common is that, do you think?
It's more common than most people think. Yeah. So I think it's quite a common occurrence, and I think there hasn't been a lot of discussion around that. And yeah, I think that is very common. So in that situation, like the advice is that pharmacists always double check their own work. So yeah, it's not ideal, but unfortunately, the way things work in pharmacy is that type of pharmacy definitely do exist, and they are always around. And that type of pharmacy is what it was, if you like. That's how pharmacy used to be run. It used to be run by just one pharmacist.
By one person, yeah.
And
of course.
Yeah, by one person. Yeah, that's correct.
So I mean, there's it would be ideal to have a 2-person check in all pharmacies, but practically that isn't happening. So I mean, if there was to be a tweak in the law or a proposed law change to make sure that there's a 2-person check in all practices and all pharmacies, I mean it's not doable, is it, Lanny? There's not enough people.
Yeah, there needs to be a lot more support and resources provided for us to do that. So at the moment, the way pharmacy work is that we are very much volume based. So the more you dispense, the more money you make. So there's this fundamental flaw in the system. So it's a constant challenge for us every day to dispense more prescription, because that's the only way to make. That's the only way to keep the pharmacy viable, is to dispense more and more prescription. As soon as you hit something that is that's a little bit tricky, that requires more care, you make less money, if that makes sense. So we need to be supported to care, if that helps people understand. We need to be, if there was a complex prescription or complex situation that we've dealt with, we need to be recognized for that type of work. At the moment, the way pharmacy is funded, we are absolutely not recognised for that type of work.
I see what you're saying. Yep. What do you say, though? I mean, I know this kind of popped up last year. I was talking, I think, with one of the heads of the general practice, and there had been a suggestion that to take the pressure off GPs, maybe pharmacists could take some of that workload. And people could come and see the likes of you, and and you're almost like the doctor that says, well, this is as long as it's not the complex issues. Just sometimes GPs were saying, we're not wasting, but we're seeing a 15 minutes with a patient. It is just head cold. Have this and go to bed. Is that something? Do you think pharmacists could take on more, or from what I'm hearing, you've already got enough on your plate?